I'm Jaya Rajimathai, psychiatric nurse practitioner, and this is April. April is the month of Autism Awareness Month. So this year, the theme of 2024 for autism is moving from surviving to thriving. So as a citizen, it is all of us has the responsibility to provide a safe environment for the autistic to thrive. And today we have Dr. Sini Abraham with us. She is a child and adult psychiatrist. She is going to talk more about the neurodevelopmental disorder, autism. This video is meant to provide an awareness to the community. This is not for a treatment and clinical purpose. So let us listen from Dr. Sini Abraham more about autism.
Well, Jaya, first I wanted to thank you so much for inviting me to talk about autism, and also for your initiative that you've taken for providing not just our community, but globally awareness about mental illness so people can get more treatment options and provide care for themselves and their family members. So as you know, Jaya, it's autism spectrum disorder, also known as ASD often. It's a neurodevelopmental disorder and typically characterized by social interaction and communication deficits. And that's in multiple arenas. It's not just going to be in the home environment. You'll see it outside for children. There's school environments, social environments as well. So people want to know what are the causes of autism, right? And currently that's really still unknown. There's lots of research that's being done globally about this. However, some of the factors that they've looked into is, genetic factors, childbirthing, trauma, hypoxias, right? Older maternal age during pregnancy, in addition to intrauterine infections that can lead to it. Even though there's multiple potential etiologies, the actual cause is still unknown. Family history is a really strong factor, right? So if yourself or a family member, a blood relative has been diagnosed with autism, the chances of another family member or your child having it goes up significantly. Also, the predisposition for males to develop autism is about 4 times higher than females. So with regard to diagnosis, right? So it's very difficult early in childhood, even though this is something that is neurodevelopmental, happens early in childhood. Diagnosis typically doesn't happen until much later because awareness, right? So part of a parent recognizing what are typical versus atypical or neurodevelopmentally atypical behaviors that they notice, which is why it's so important for parents to take their children on regular visits to the pediatrician, right? So monthly and appropriately, right? So the pediatrician or the developmental pediatrician is able to screen and appropriately advise parents if further testing is needed.
So is there anything like how early we can detect it?
So you start to see, some of the signs and symptoms of as early as sometimes, 9 months, 12 months, where you start to see, connectedness not being there as much, or for a child, even something as simple as eye contact, right? And but most of the time, by 18 months to 24 months, it becomes a little bit more clear, right? There's that separation that you start to see from children that are outgrowing your typical neurodevelopmental rate compared to a child who has autism, you start to see a separation around that point where parents will start to say something seems different about my child and take the child into the pediatrician. And after that, following up on further evaluation at that point.
Any special diagnostic test for any blood test or anything?
So there's not really blood tests, right? So there are other genetic disorders that can be present in children that also have autism spectrum disorders, such as Fragile X or Rett's. And so sometimes a pediatrician might recommend for you as a parent to take your child in for genetic testing to rule out other genetic disorders, but not specifically a blood test per se. Typically, developmental pediatricians will recommend, or will recommend for the parent to take the child in to see a clinical psychologist. These are usually PhD psychologists who do neuropsychological testing and evaluations specific for evaluation and diagnosis of autism.
Okay, so is there anything for especially for parents or teachers to look for any kind of sign and symptoms?
So that's a really good point, because if they don't know what to look for, how do they know I should take my child in for an evaluation? Right?
Because as we know, all the kids are not the milestone, and growing up is not the same way.
Exactly.
Different kids have different way of growing up.
Yeah.
So
exactly. Just like talking doesn't always happen for every child at 12 months or 9 months, right? There's a huge variation, right? But there's that typical variation versus an atypical variation, right? So prior to a child going to preschool, right, around the age of 3 or so, parents can start to look for around 18 months. They start to see that maybe the child isn't connecting with me, right? They're when I'm talking to you, my natural inclination, and even with young children, is if somebody talks to me, I automatically shift my gaze and I look at you, right? Or like you're smiling to me when I'm talking about something, right? Or nodding your head. And these things, even in young childhood, toddler age, you don't see these kind of things in these children.
They don't look at our eyes.
Yes, and so they'll be preoccupied with something else, right? Often when a parent brings a child in to see me, I mean, usually I see kids around 3. If usually earlier than that, they're going to the pediatrician, right? So around 3 or so, 3 to 4, they're starting to bring a child into a psychiatrist, because they're starting to notice they've gone to preschool, they're starting to notice some other atypical behaviors and concerns. And so some of the early questions that I'll ask parents is, when your child was, between 1 and 2 or between 1 and 3, what were their interactions at home like, right? As a child, did they spontaneously come and give you hugs or say, I love you, Mom, or come and spontaneously give you a kiss, right? And most of these parents will say, no, like I noticed, like I would have to go up and go give my child a hug, or when my grandmother would come over, she goes and gives the child a hug. He doesn't immediately go and go to the grandmother, and as you see a lot of little kids do, right?
And is it true that some of the parents coming and telling that even though they are not comfortable, if the parents giving hug also, they are not comfortable. They want it when they want, they will ask them to give it.
And they might not even ask, right? And so they kind of just stand there, versus like you see a child that appreciates and wants and receives the hug, right? Or they hug you back, right? Or they kiss you, or you say I love you, and they will immediately say I love you back with affection, right? So being able to notice those type of behaviors, right? So there's there's restrictive, repetitive type of behaviors that happens as one of the signs of autism as well, right? So you'll start to see when they're, let's say when they're playing, right, it's more they're not doing the imaginative play that you would expect, right? So I'll ask parents, when your child was younger, Did you see them get the dinosaurs and cars and pretend play, right? They're making noises like the dinosaur they've got too, or like girls with, Barbie dolls. Are they pretending to be the mom and feed the baby and stuff? And most of these parents will say, no, that's really not the case. What they typically do is they will just line them up and do more repetitive type play, right? Versus imaginative play,
Okay.
right?
Yeah, that is good to know. And like anything about their speech?
Yeah, so that's a really good point. So communication, part of it is like we talked about social communication interaction deficits, right? Those are the 3 hallmark signs, right? So social has to do with the play, right? More parallel play. Communication has to do with, sometimes you'll see more repetitive, right? So it can be echolalia, and echolalia is when you, like, if I say, oh, Jay, I love your shirt that you're wearing, and instead of saying thank you, your dress is pretty, you might say, I love your top that you're wearing, and you'll just repeat what I say. I like your earrings. I like your earrings, right? Versus that true interaction that's happening.
Yeah, is that it says they are not understanding the question, that it's not processing, their brain is not processing. That's why they are
their communication deficits. Like when they looked into, like when psychologists are doing testing, right? Part of the testing that they'll do is IQ testing, right? And it also has to do with like gold standard testing for autism has to do with ADOS, right? So ADOS is autism diagnostic testing that's done, right? And with that, they're able to look into with the IQ, what you start to realize is their IQ it can be normal to sometimes even high, right? It doesn't have to be. People sometimes have this myth that patients with autism, their IQ is low, and that's not necessarily the case, right? It can be above average even, right? So their communication deficits isn't necessarily because their IQ or language skills per se isn't there, but their ability to interact isn't there. Last has to do with, the interaction, right? So by the time these kids are going to preschool, or even with siblings or neighbors and stuff, you start to see their interaction isn't that back and forth type of interaction, right? As I've mentioned earlier, it's more parallel play, right? A child will be playing with the doll over here, and the child is right next to them, not interacting with the other child. They've just got like their doll, and they just do their own thing. It's like their own world that they create, right?
Okay. So you are talking about like their communication, social interaction, and repetitive behavior. Anything else?
With regards to
Some sensation?
Yeah, so there's also sensory deficits that can happen for these patients, right? So a lot of times it has to do with, parents will say, I try to put socks on my child or shoes, or the shirt has a tag in the back, and they will have emotional meltdowns, right? It's not like coming to you and saying, this tag makes me uncomfortable. They because sometimes they're unable to verbalize, right, their emotions or what they're experiencing, and they might not even know at that age. It's more emotional meltdowns that they're having. So it could be restricted food intake, right? Textures with food.
They don't want to touch.
They don't want to touch, or even when they try to put it in their mouth, they don't like certain textures of food, temperatures, light sensitivity, noise sensitivity, right? And so all of these are triggers for a child, and they start to have these emotional meltdowns. So most of the time when they're bringing a child to a psychiatrist, it's because the child is emotionally dysregulated, and the parent either knows the child has been already diagnosed with autism, or they're concerned about these outbursts that are happening and trying to understand what it's from and how to appropriately treat that.
So these outbursts can be aggressive too?
Absolutely, right. So there's variations. They're different, with autism spectrum disorder, it's called a spectrum for certain reasons, right? There's various types of symptoms, right? Not all the patients are having all of these symptoms, right? There's different severities, right? So there's level 1, 2, and 3. And so 3 would be the most severe that you would see. So if you have a patient that's at level 3, Their communication deficits might be, they might be nonverbal, right? And so for them to be able to tell you what they need isn't there. So then by the time they're either at home or going into a structured school environment, what you start to see with these children are severe aggression, right? Either towards themselves or their environment or towards other people, right? And that could include self-injury such as biting, head banging, or physical aggression towards other caregivers as well, or other children, right?
Yeah, it's if we are not understanding what they are going through, yeah, it's very hard for them and the caregivers too.
Exactly.
Yeah.
Exactly.
And anything else for the diagnostic part, you want to talk to the parents?
Absolutely. I think one of the hardest things is, when a parent brings a small child to you for an evaluation, right? And they don't know, and then you do your screening, and then before you're recommending, okay, I need, you to do genetic testing, see a clinical psychologist, as a provider, based on these signs and symptoms, it becomes clear that the child is probably on the spectrum of autism, right? To be able to tell a parent that, my clinical impression after, a clinical interview is that more than likely it's autism spectrum disorder, for sometimes it's very devastating to them, right? And for them, they also need to not only understand what it is, but how to then appropriately care for the how to handle the child, right? Because sometimes it's like, okay, I'm going to give a child consequences for these behaviors, right? And it doesn't work for the parent, and it doesn't work for the child, right? So once, a lot of times parents, even though it's hard to hear that the child has been diagnosed with autism, or this is the likelihood of what it is, knowing it is actually a relief, right? Because they start to understand that I can help my child in so many ways. I don't have to punish, because this isn't just my child being a bad child or oppositional, right? It is something that I can go and get play therapy or specific types of therapies to help my child develop in a better rate than what's been going on, and for my family functioning to improve as well, right?
Okay. And when we talk about their learning, how is it? Like, do the teachers or the school has to provide them any special education program? Or
so that's a really good point, Jaya. So schools within the U.S., public schools have different programs. I mean, starting at age 3, right? So you have PPCD programs, right? You have early education programs. So these are programs that are set up not specifically for autism, but definitely inclusive of it, right? So these children can get services before they ever start kindergarten, and that makes such a world of a difference, right? So there's different types, as we had talked about before, with diagnostic testing, right? So once you do, the pediatrician or geneticist does the genetic testing, and then the clinical psychologist does appropriate gold standard, clinical testing, psychological testing, then it's figuring out what type of therapies are needed, right? The earlier you intervene for a child, that's why early intervention and diagnosis is so important, right? There are times patients come to me and they're already upper elementary, middle school, and sometimes even high school. I've had adult patients, they probably have more level 1, right? Autism spectrum disorders, where they've never been diagnosed because their IQ is probably average to high, but the patient themselves will come and tell me, I noticed that I don't really connect with people in society, right? And they come in and they don't have the same eye contact, right? I'll be looking at them during their appointment, and they're looking down and they're having full conversations, but they barely look up and have that eye contact, right? And they might be in their 20s, 30s, 40s, 50s, right?
Yeah, it's remind me, I have a patient, like she's in her late 40s.
Yeah, exactly, right? And so the earlier you diagnose, the earlier you provide treatments and intervention, the better the prognosis is. In regard to treatment, early in childhood, it's really important to start therapy. Gold standard therapy for autism is applied behavioral analysis, right? Such as it's called ABA. ABA treatment is nowadays covered by most insurances throughout the nation and provided in different clinical settings. In addition to that, these patients have sensory issues. So usually I'll recommend a patient to their family to take the child to occupational therapy. Sometimes they'll also have motor or developmental, fine motor, gross motor skill delay, right? So physical therapy as well as occupational therapy can be helpful. As we had mentioned earlier, there's also communication delays, right, or struggles, whether it's like repetitive type of speech or other delays. And so usually I'll recommend for a child to also be seen by a speech therapist. Now, school environments also provide a lot of these services, right? So once a child is diagnosed and formally with autism spectrum disorders, if you take the testing to the school, then the school can provide different types of social therapies like social skills groups within the school environment, occupational therapy, speech therapy, all within the school setting. So it really makes a big difference when you're getting it at school, plus also you're getting it outside of the school environment as well. The last has to do with treatment with medications, right? So parents, when they come in, they want to know, okay, my child has autism, so what is the medication that can be given to my child? And the reality is there's no specific treatment just for autism, right? However, patients with autism have multitude of other symptom clusters that we see, right?
Can be mistaken by other diagnoses.
Absolutely, right? So in the school setting, sometimes, let's say this child with autism that hasn't been diagnosed is very hyperactive or inattentive, and then the school will say, oh,
it has ADHD.
Yes, this child I think has ADHD. You need to take him or her in for an evaluation, or they're having meltdowns, they're aggressive, right? They think it's a mood disorder, bring the child in, or it's severe anxiety, right? Social anxiety that you start to see. However, by the time you do a formal evaluation and testing, you realize, okay, this is actually symptoms related to the autism, not specifically that is ADHD. Now, there are times that children come in and I have autism as a diagnosis and they have generalized anxiety or ADHD or other things, right? So when I'm thinking about treatment with regard to medication, I'm thinking about what are the symptoms that are causing a significant impact, negative impact on the child's life, not in multiple settings, right? So if this is just happening at school, but the child is fine at home or other social areas, that's, there are accommodations that can be done in the school setting to help the child, right? So, a child that is having ADHD-like symptoms with significant hyperactivity or inattention, then considering stimulant medications or non-stimulant medications that are used, right, to treat ADHD, or a child who has very restricted, inflexible behaviors, right, which can be seen in patients with autism, or significant social anxiety, right? I'll consider medications that are used to treat anxiety, right? And most often, there are medications that are SSRIs. There are some that are approved for these kind of uses. And for patients that have severe aggression, whether it's significant self-harm, destructive behavior to property, or aggression towards peer adults, caregivers, those kind of things, then we might consider certain anti-aggression medications or even mood stabilizers for these children. Right? So a lot of these medications aren't FDA approved. Some are, but they are used pretty commonly throughout the nation with a lot of benefits, not only to help the child function better, but also to help the family function better, right?
Yeah, that's correct. And I read that the TMS can help.
So they're doing a lot of research. TMS is not FDA approved for autism,
not FDA,
right? And it's also TMS at this stage is not even FDA approved in children or adolescents, right?
Mm-hmm.
But there are, throughout the nation, research being done on autism spectrum disorders and showing some promise as
Yeah,
well.
yeah, yeah.
So it's exciting.
Yeah, TMS is a transmagnetic.
Transcranial magnetic stimulation, right?
Yeah.
So it is FDA approved for depression in adults,
Yeah,
right?
yeah,
Uh,
yeah.
but
We will talk about that later. I will
yes,
come and get you for that. And I know that there are a lot of patients and people are interested, showing interest. Even providers are asking to learn and know about TMS. So I will come back to
absolutely.
you for that. But for now, as a summary, autism is a neurodevelopmental disorder. And can you please summarize it for? Yeah.
Absolutely, absolutely. So, as we've talked about all this time, I mean, autism spectrum disorder, ASD, is a neurodevelopmental disorder with a cluster of symptoms that's seen in early childhood with social interaction and communication deficits, right? And a lot of it present with, restricted, communication or motor symptoms, inflexibility with different things, as well as fixated interests that they have, in addition to sensory deficits. And you can have a mixture of it. So early intervention is the utmost, most critical, right? And so awareness about what these symptoms look like, taking your child into the pediatrician for regular well checks from birth throughout their years, and appropriate screening that can be done with clinical neuropsychologists, as we had mentioned, one of the gold standards being the ADOS test, right? Autism Diagnostic Observation Schedule. And then ABA therapy, applied behavioral analysis, as one of the hallmark gold standard therapies that can be done, in addition to considering physical therapy, occupational therapy, speech therapy, and consideration of appropriate medications when certain symptoms are severe and causing dysfunction for a child is really important. And the most important is helping the family, the parents, to give them support, because it is not easy emotionally or physically for a family to go through this, right? And
Yes.
so as a provider, that's one of the best things that we can do, not only helping the child, but helping the family to function well, right?
Yes. As Dr. Abraham says, it is a neurodevelopmental disorder and there is no cure for that, but we can support them, help them to thrive. And this is like a combination of, there's a treatment team, like a pediatrician and pediatrics psychiatrist, then the psychologist, then the therapist, speech therapist, occupational therapist, then the psychotherapist, and even like a social interaction. The parents has a big role. Yeah, it was very good, and I hope we all get an understanding about autism and the treatment. And now, what is your suggestion for the as a whole to tell to the parents?
Absolutely. As parents, my advice would be understanding that every child is unique in so many ways, right? Every child has strengths and weaknesses, and they're a blessing to us, right? And so, whatever the diagnosis is, whether it's autism or something else, being able to first know what the problem is, right? So, once you know what the problem is, then understanding, okay, what are my child's strengths, and building up those strengths. And if there's certain weaknesses, finding the appropriate therapies and treatments to help support the child and their weaknesses, for them to grow up and to be wonderful, amazing adults.
Yeah, that is very good. And thank you very much. Thank you for your time. And next week, I'll be coming with how to take care of the speech part of the autism kids.
That is awesome.
Yes, yeah. And Dr. Abraham, thank you very much. And I'm very proud for this moment because you helped me to learn. And from my beginning, you are my teacher on this process of my learning. And thank you very much for all the support for me and for my patients. Thank you very much.
You're very welcome. Thank you again for having me.